Hi everyone, this is Dr. Susan Marra with Dr. Marra's Medical Minutes and Juju. And first off, I want to wish you a very Merry Christmas and a wonderful holiday season. I hope that 2025 is a better year for everybody. So today we're going to talk about the nuances of treating Lyme disease. So 26 years ago when I started treating these, I was in Connecticut, and most of my patients only had Lyme. And we would treat it, and, we'd get it under control easily. Then through the years, there was just more and more and more and more co-infections. Till now, I would say most people come back with 3 or 4 or 5 or 6 co-infections. It's dramatically changed. And what happens when you have, well, first of all, you're way sicker. When you have 6 infections and they're all attacking your cells, you're really sick. But what happens when you treat multiple infections is you're usually heavy-handed on one of the infections, and you can tell by the symptoms which organism is most prominent at that time. And then either the herbs and the antibiotics or both go after that particular organism, and they decrease the pathogen load. And then once you do that, then another one pops up. Then you decrease that, then another one pops up. And that's how the treatment of multiple tick-borne illness goes, provided there is not mycotoxin illness or a COVID vaccine or long COVID present. If those things are present, then it's way more complicated. So generally what I like to do is I can tell by the collective symptoms that someone's having what organism is most prominent, and that's where you start treating. So if it's Lyme, you start treating Lyme. If it's Bartonella, you start treating Bartonella. I would say that Bartonella is usually screaming the loudest because you see neuropsych symptoms like depression, rage, anxiety, OCD, ADD, Tourette's. And so you can't miss it. And so, the treatment is going to be heavy on Bartonella. So you're going to use antibiotics that largely target Bartonella. And some of those antibiotics also treat Lyme, but less so. And then you'll lower the Bartonella load, and then Babesia will pop up. Then you treat Babesia will come down, and then Lyme pops up. So it's really this symphony of infections, and they generally do not all present at the same time. Now, that doesn't mean that they're not all causing havoc. They are at the cellular level, but symptom-wise, usually you can tell which organism is the most problematic at the time. And that's where you want to begin treatment. So that's why a lot of my patients will say, but, my night sweats came back or my rage came back. Well, it cycles as well. So you lower Bartonella, then Babesia goes up, then you lower Babesia, then Lyme goes up, you lower Lyme, then Bartonella goes up. It's a cycle. And every time you treat, the cycle amplitude gets less and less. So that's how you treat tick-borne illness. And then in my practice, I was trained by Dr. Jones to treat until there's no symptoms, then treat for 3 more months with antibiotics. And then after that, use herbs for about 6 months. And then when they come off, counsel them what to do if they relapse. If they relapse, they need to go back on either herbs or antibiotics. So, people ask me, well, how long should I be on these things? It's really different for everybody because everybody's body handles the infections differently. So, some people only have to be on for a year or 2. Some people have to be on for 10 years. It just depends. It also depends on how long you've had the infection and how severe the infection is. So I hope that you found this information helpful, and I hope you have a wonderful holiday from Juju and I. Bye-bye.